Good evening, everyone. Thank you for tuning in to our live session of Did You Know That Diabetes Can Break Your Heart? In conjunction with World Diabetes Day, which was held on the 14th of November, we aim to educate and aid everyone on the topic of diabetes with the help of our local experts. Our main topic will cover the risk of health disease in diabetic patients. Before we kickstart the session, a short introduction of myself. My name is Victor Cheong and I am from the STARS event team. On behalf of our team, we'd like to thank Boehringer Ingelheim for supporting today's live on web session. It is definitely an honor to have them with us. Tonight's session, we will be joined by Datuk Sri Dr. Azari Rosman, Senior Consultant Cardiologist from Institute Jantung Negara, Professor Dr. Chan Siu Ping, Senior Consultant Endocrinologist from University of Malaya Medical Center, and it is moderated by Dr. Azani Muhammad Daud, Consultant Cardiologist from Gleneagles Hospital, Kuala Lumpur. A quick note, this event will be cast live on our Facebook Starbase page. The Facebook link stream will be found in the chat box below. So please do share across with your friends and family so that they'll be able to join in tonight's session as well. All right, a few quick housekeeping matters before we begin. As everyone dials into this webinar through different internet bandwidth and devices, you may or may not experience minor technical glitches. So please be patient if there's any. To minimize the risk of technical glitch, all participants are muted and video cam turned off. But do participate by posting questions to our panel. On your user panel, click on the Q&A button and post your questions if you're using Zoom, or place it on the comment section if you're watching via FB Live. Without further ado, I will now pass you to our moderator, Dr. Azani. Dr. Azani, over to you.
Hello, can you hear me?
Yes.
Are we on? Yeah, okay. Assalamualaikum warahmatullah, and a very good evening to everyone. And I would like to welcome you all to today's webinar, which is entitled, Do You Know That Diabetes Can Break Your Heart? I'm Dr. Azani. I'm a consultant cardiologist working in Gleneagles, Kuala Lumpur, and I shall be moderating this session this evening. I understand that some of you have joined via the Zoom platform, and we have around 240 participants via that platform, and then about the same number again who have joined via Facebook Live. Now, as you are aware, World Diabetes Day was celebrated on November the 14th, and this event today is part of the events that has been arranged really to promote awareness of diabetes in Malaysia as well. This has been organized by the Star Media Group, as well as the organizers of the For Your Sweetheart campaign. And I wish to thank both of them for making this event possible. Let me say a few words about the For Your Sweetheart campaign. It was started mainly to promote awareness that heart disease is a serious consequence of diabetes, and also to put across the message that most patients with diabetes actually succumb to heart disease. The organizers of this campaign are the Malaysian Endocrine and Metabolic Society, as well as the Malaysian Diabetes Educators Society, and they are supported by Boehringer Ingelheim in this endeavor. Now, the Sweetheart campaign has also got a website, foryoursweetheart.my. Flash it up. And if you were to visit this website, you will find that there's a lot of information there about diabetes as well as diabetes-related heart disease in simple to understand language that everybody can understand. And there are important messages there that you can access, whether you are diabetic or a relative of a diabetic, to know more about diabetes and heart disease. Okay, there's the website flashed up. So please visit the website and use it to gain more knowledge and understanding about heart disease and diabetes. Now, tonight we have two experts in their own fields who will discuss, help us to discuss how diabetes affects or promotes heart disease. The first speaker that we have is Professor Chan Siu Peng. She's a senior consultant endocrinologist at both SJMC and UMMC, University of Malaya Medical Center. She's actually the current president of the Malaysian Endocrine and Metabolic Society, which is one of the societies involved in this campaign for your sweetheart. She is very active in the local scene as well as internationally, and has been well known speaking about numerous topics on not only diabetes, but also endocrinology. So can I welcome Professor Chan to say a few words about diabetes first to get the ball rolling. And amongst the topics that she will try and cover is really the prevalence of diabetes in our country, how bad it actually is, and perhaps why it's becoming so bad, and then we will take it from there. Prof. Chan?
Thank you very much, Dr. Azani. Good evening, everyone. Good evening to my fellow conspirators today, Dr. Azani and Dato' Azari. We are very glad that you have decided to tune in on a Friday night. I hope that you've had your dinner and that you can spend the next hour with us. So I'm just going to give a quick brief to set the scene, to actually, again, as Dr. Azani says, that we need to be aware of how common, how frequent we have diabetes in Malaysia, and that in fact, I'm really very, very encouraged when I have cardiology colleagues who are sitting up and seeing that diabetes is such an important contributor to heart disease. And that's the reason why we have, had this very catchy phrase of having a broken heart, all right? But we don't want you to go home with bad news to say, oh my God, diabetes can cause heart disease, can cause me to have problems with my heart and heart failure. We want to also share with you the really incredible news that we can mend this broken heart. We can stop you from having a broken heart. Okay, so moving along, I am trying to change my slides, sorry. Okay. Next few slides is, let's just look at how common it is seen in Malaysia. And I would like to perhaps say that we have an epidemic of diabetes in Malaysia. It's not coming, it has already arrived. Then on top of that, it contributes to heart disease. I will only say a few words about it because you will see a much more expanded talk on that by Dato' Sri Azari. Okay. And can we do anything about it? Again, same thing. Very, very exciting news that we can mend, we can perhaps not even talk about mending, prevent you from having a broken heart. So starting along with how frequent do we see diabetes? Unfortunately, if you look at this slide, 18% of individuals above the age of 18% above 18, all right? That means 1 in 7 people has diabetes in Malaysia. We have the highest prevalence in this region. So we are champions, a championship we don't want to win, all right? So out of that large number of people, which ethnic group unfortunately has the largest burden of disease? And you can see here, the largest burden of disease are the Indians with 30%, the Malays 23%, Chinese 15%. Hey, you Chinese, don't think, hey, we got the lowest. It's still double digit, right? It's not something that you want to be very proud of. So if you actually just encapsulate it, 1 in 5 adults in Malaysia have diabetes. And just to think about it, it's actually a massive problem. That translates to almost 4 million people in Malaysia with a total population of 34 million having diabetes. And if you think to yourself, yeah, Dr. Chan, I'm young, I'm safe, right? That's not true. Look at the proportion and prevalence of diabetes according to age group. So I just highlight it for you. If you belong to 40 to 49, 2 out of 10 would have diabetes. 2 out of 10. If you belong to the 50 to 59 age group, 3 out of 10. If you belong to the age group above 60, 4 out of 10. These are frightening numbers. But those of you who think to yourself, hey, SP, I'm still 30 to 39, that's 1 out of 10. If you actually look at the lower part of that slide on the left. Okay. And unfortunately, we really realize that if you have diabetes at a younger age, and when we say younger, it is younger than the age of 45. All right. So if you have diabetes diagnosed younger, earlier than age of 45, that's even worse news because 2 out of individuals will have a heart attack, a stroke. That's what we call a macrovascular complication. And you compare to an individual who is less than 45, who does not have diabetes, 14 times higher chance of having a heart attack. Those are frightening numbers. This is data from the National Diabetes Registry from the Ministry of Health, only taken last year. They manage 80% of our people with diabetes in Malaysia. And when we looked at that registry, which is an audit, we found that 8 out of 10 also have hypertension, 75%, 3/4 of them have high cholesterol, and 84% of them are either overweight or obese. And this is kind of like the empat sekawan. It comes whether you like it or not. Each of these problems increase your risk of heart disease. When you have 3 or 4 in the same person, you are a sitting time bomb for a heart attack. So the question next comes to, does it translate to higher risk of heart attacks? And I've just shown this quickly because Dato' Azari will expand on it. This is data from 2016, 2017, collected from patients admitted to the coronary care units in the whole of Malaysia. And we found that 45%, almost 1 in every 2 people admitted with a heart attack in Malaysia have also got diabetes that is causing that person to have the heart attack. We call ACS the medical term for heart attacks. I'll just digress a little bit. We also know that diabetes causes kidney failure. For the same time interval, 2 out of every 3 patients requiring dialysis, diabetes was the cause. So it contributes to significant morbidity, significant ill health. So we want that message to go out. Don't think diabetes is just high sugar, I feel well, doctor, don't bother me. That kind of, we do not want that scenario, that thought. But this is my last slide. I am very, very happy that we have good, better, and best drugs that we can choose to improve the outcomes for people with diabetes. And that there is now, what I would say, there is hope that rather than what I showed you about the chances of having a heart attack, chances of a young diabetic having a heart attack compared to that person who doesn't have, that we can actually change that trajectory, we call it, that high risk for heart disease and heart failure and death. We can reduce that risk. And so welcome, let's have a conversation about this. I'll pass it back to our chairman, Dr. Azani. Thank you.
Thank you, Professor Chan, for enlightening us on how common this problem is in Malaysia and some worrying facts. If you look at the slide there, roughly between 5 to 12%, depending on age group, don't even know they have diabetes. And we will talk a little bit about that later on. I would just like to remind the audience that you can submit questions to us, and we will look at the questions and we will try and answer as many as you can, and you can start submitting the questions even now. Our next speaker will expand more on the broken heart in diabetes. And it's my pleasure to introduce Dato' Sri Dr. Azhari Rosman. He is a senior consultant cardiologist at the National Heart Institute, or IJN, in Kuala Lumpur. He is an advisor of National Heart Association of Malaysia. He's also an past president, ex-president of Malaysian Society of Hypertension. Very active again in educating not only the public, but also healthcare professionals. Over to you, Azari.
Thank you very much, Azani. Assalamualaikum, everyone, and thanks for being with us. I know this is late in the day on a Friday night. You got better things to do, but I hope you'll be able to gather some information to share with your friends, colleagues, relatives, and for your own information. Now, if SP Chan has given you a picture of diabetes and how bad it is, take it from me, it's actually worse than that. You see, because the problem is diabetes actually has a very different trajectory. For the cardiologists, it is actually a major problem because many people actually don't live out their lives long enough for the complications of diabetes to actually occur. Many of them talk about, I get kidney failure, I get this and that. But, we have, National Heart Institute figures in IJN. We've done a registry of people who have had heart attacks. And about 65% of people who may have had angioplasty actually have diabetes. Just a few weeks ago, I was trying to count with my nurse. How many, I said, Fiza, how many people in today's clinic are actually diabetics? So tick, 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 tick. 7 out of 10 are actually diabetics in my clinic. So I was trying to get one which is not a diabetic, So, it's out of 3 out of 10. Most of them on my outpatient follow-up are already diabetics. Now, it's not representative of because of the situation in Malaysia as a whole, because, we are a referral center. Many people already have coronary artery disease. But it gives you an idea of how big this problem is when it becomes coronary artery disease. Now, I urge you to consider this very first slide of mine. So let me just share this slide with you. This is meant to be a very relaxing Friday night, but anyway, I hope that it will be not as frightening as I put it to be. But you see this angiogram. This is the angiogram of a 34-year-old individual. All right. Of course, he's overweight. He's 97 kilos, but he only got diagnosed to have hypertension a year ago. See the vessel? This is an angiogram of you see the arrow there? That's my pointer. And you can see this is the vessel of the left coronary system. This is the original, this is the tube, by the way, for those of you who are not familiar with angiogram. This is the tube. We put this tube into the mouth of the heart there, and then subsequently we inject a dye, and that flows down. That black part is the dye that goes down the vessel. This is pretty much the normal part of the vessel. But as you go beyond that, maybe 2 millimeters or 3 millimeters down here, you can see it's all disease and narrow and thready. And here it's like thready and small and narrow again. This is another view of the same vessel, right from maybe about 4 or 5 millimeters from the mouth of the vessel. You can see it starts to narrow. Everything is narrow. So this is usually it's about 3 millimeters in diameter, but this has gone down to about 1.75 even, very small millimeter vessels. And this is in a 34-year-old individual, who is only diagnosed to have diabetes 1 year. The father had bypass at 65, the brother had bypass at 34 years old. So this is also a genetic thing. But the fact remains that if you look at vessels like this, the first thing that comes to mind is 2 things. The first is actually, how long has he had this disease? Because diagnosed to have diabetes only 1 year ago. But you look at the vessel, this is as though they're 15 years ago, the vessels have been diseased. So my point is that the vessels actually affect your disease actually affects your vessels long before your blood test becomes positive, long before. So the next problem is, if I'm going to stent or surgery, for example, where am I going to stent? The whole vessel is disease. If I put a coil, they call it a coil, stent or whatever you call it, but a metal spring to keep it open, which part of it? So I tell maybe I send to the surgeon. Surgeon's going to look at this vessel and say, oh, well, where am I going to put the graft? If I put the graft here, for example, further down, it's all disease. It's like changing the pipe in your house. If I change the main pipe of your house with bypass surgery, the inside taps of the house are still diseased. So you're not going to get a whole lot of flow right down. And what's worse is that these guys are young, 34 years old. So really, The situation with diabetes is a matter of survival. All right. So you want to change the trajectory of disease, and as SPS mentioned, the best news I've had in decades is the fact that there are now methods and treatments available for us to change the potential outcome of the disease. But that is cognizant upon one very, 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 very important point, which is you must take the initiative and the motivation to do something about your disease before you end up into my clinic. So that's my point. Now let's go to the next slide. I'll show you the next slide, which is basically what we all know. Cardiovascular disease is a leading cause of death. We're not talking about disease, just disease. We're talking about death in Malaysia. And we are a relatively young population, aging no doubt, but still we are a very young population. And again, as she's mentioned, it's a 4-in-1 or 3-in-1 grouping of disease. Diabetes, hypertension, high cholesterol actually has a similar pathophysiology on the vessels. They affect them in similar ways. What is the end result? The end result is a shortening of lifespan. Not really, that's the bottom line. It does shorten your lifespan. If it doesn't, it makes your life miserable, so the quality of life drops. It breaks not only, believe me, friends, it doesn't break the heart, your heart, it also breaks the heart of your relatives, close ones, and loved ones, and so on and so forth. Really, the story doesn't end there. So where does it start? Have a look at this. This is a simplified cartoon, if you like, of how the plaque actually develops. Remember, I was telling you that this disease actually starts long before your disease on the blood test manifests itself. So we'll talk about what we need to do in order to avoid that diabetes being manifest in the first place. Yeah? But be that as it may, this is the process that goes on. First of all, you have a very nice, pristine vessel. Atheroplaques start to develop maybe in the late teens, depending on population and your profile, so on and so forth. But it starts to develop maybe faster in some and slower in others. But by the time you're in the 20s, streaks start to develop, and it may stay that way for many, many years. But if there are reasons why it should go faster, for example, you have risk factors like smoking, high blood pressure, especially sugar. This sugar, let's call it, it's abnormal sugar. It's not just necessarily in the diabetic range, but these abnormal sugars already start to have breaks in your vessel lining. So at the end of the day, it boils down to vessel lining that's intact, right? Whether or not your lining is intact or not. So sugar levels affect your intactness, if you like, of the wall. Insulin levels, which are high, which is a precursor of diabetes. When you have abnormal insulin level, that is a part of diabetes. That also directly impacts on your vessel wall. So this is a completely different way of looking at things. It's not just a matter of sugars, yeah. It is a matter of blood vessels and ultimately survival. Okay, survival. So here is a timeline. Now, as I mentioned earlier on, if you look at the development of diabetes, you know the risk factors for cardiovascular disease, not risk factors for diabetes, risk factors for cardiovascular disease start minus 15 years. 15 years before the manifestation of cardiovascular disease itself. So the risk factors like hypertension, high cholesterol, and so on. Then by about 10 years, as I mentioned, the development of plaque starts to kick in. Now, whether it goes fast or whether it goes slow is another matter, depending on profile, but it will start to develop. And by the time it starts, by the sugar actually develops, the vessels are actually diseased. So we have a saying in cardiovascular circles, you are only as old as your vessels. Yeah. You may be 21, and believe me, we've seen 21 years old who have had coronary artery disease, who have had bypass. Our youngest bypass, and I keep saying this in many of my lectures, our youngest bypass in IGN is, guess what? 21 years old for a female and 22 years old for a male. How about that? So this may come as a surprise to you, but in Malaysia, nothing is a surprise. Yeah, we are full of surprises. Anyway, so the point I'm trying to make is that we can do something about it if we want to. There may be reasons that make it difficult, for example, if we have a family history, but then I always tell my patients, you know, having a family history is like having a gun in a drawer. Nothing can happen if you keep that gun in that drawer locked up and nothing happens. The problem is once you start having risk factors and you start smoking, you become overweight, you become sugar, all those risk factors, then that gun actually comes out of the door and becomes a potential lethal weapon. It's a similar analogy. Diabetes and genetics may not manifest if you look after yourself. So don't lose hope. Even if you have family members who have diabetes, uncles and aunties who have diabetes, or parents who have diabetes, not necessarily your kids are going to get diabetes. On the other hand, if you don't have diabetes, but your kids don't look after themselves early on, they become obese, overweight, drink lots of sugar, and so on and so forth, inactivity, they might develop diabetes. So this is where it becomes a little bit different, yeah? And you must know this. By how much is life expectancy reduced? Well, if you have cardiovascular disease and diabetes, the two lethal combinations, a marriage of sheer inconvenience, you can see that diabetes and cardiovascular disease shortens your lifespan, potentially, statistically speaking. I'm not a fortune teller, by a potential 12 years, a staggering 12 years. You might say, oh, you know, when I'm 21, 12 years seems like a long time ago. Believe you me, you know, if somebody has got a potentially morbid disease, mortal disease, even a day is important. How do we know that? We deal with people who have cardiac transplant. And for cardiac transplant patients, one day to see the sunrise and to see the sunset at the end of the day is a very big deal, my friends. So really, when you talk 12 years, potential shortening, you have diabetes, you really should do something about it now, not tomorrow, not next year, not 10 years time. But if you have potentially you can do something about it, do it now. If you have diabetes alone but no cardiovascular disease, it's minus 6 years. We're talking about statistical probabilities here, yeah? So just keep that in mind. So what can I do if I already have diabetes? All hope is not lost. In fact, no hope is lost. Hope is the cornerstone of our survival. So here we are as physicians and healthcare providers to give you some hope. You must adhere to healthy lifestyle. It's very easy, yeah? Listen to your doctor, listen to the people who are in the know. Don't listen to, how shall we say it, false information. That's a polite way of putting things. If you're overweight, try and reduce your weight. You might say, oh, it's impossible, I can't reduce my weight. It doesn't matter. Even if you reduce it by 10%, it's a good start, yeah? Stop smoking if you haven't already, yeah? And certainly don't start. And remember to take a medication as prescribed. That sounds easier than said than done, yeah? Many people actually start medication and then they will see and listen to your friends and they say, Allah, why you take the medicine? No need, take this down, take this leaf, take this misai, take this that. So at the end of the day, they end up taking nothing. So by the time they come in, their coronary disease has actually started. Now, I have patients whom I have had angioplasty done before. And then they take medicines. And after they say, oh, they didn't take medicine because they listened to their friends. So the disease is never cured. Yeah, you are still at risk of developing coronary disease. So a few years down the road, maybe a few months even, they come in and they get the narrowing again. So I asked them, do you take your medicine? He said, no. Well, how come? Well, because my friend say he didn't take the medicine and nothing happened to him. So I said, well, now your disease unfortunately has progressed and involves many vessels. And, you know, it's the vessels too diffuse to do bypass surgery or even to do angioplasty. And they look at me and say, so how are doctor? Now. So what am I supposed to say? I can't say anything because the disease progression has gone beyond reversal. So that's one thing you must remember. Disease marches on relentlessly, yeah? So we are here to bring you hope, but you have to take the initiative and take the effort. Right, so medicines can help and it certainly will. So these are the targets of what you should be doing. HbA1c control. We're talking about a different level of sugar from fasting blood sugar. This is HbA1c, as many of you who are diabetics or who are keen on medical information. HbA1c is a 3-month sugar. Then blood pressure, which is very important as well. You should, that's another topic. Cholesterol level, that must come down to as low as possible. Diet, of course, sensible diet, healthy diet, and so on. And of course, lifestyle. Yeah, so those exercise and so on. So what are important medications what are the drug medications that's supposed to do? Well, they're supposed to reduce your blood sugar. They're supposed to reduce your blood cholesterol level, your blood pressure, protect your organs like kidney, your heart, vessels, and so on. So there are various medications which do different things to different organs in your body. But the most important organ that you should be looking after is, of course, your heart, yeah, because that really shortens everything before the complications start to kick in for the other organs anyway. So if you're unsure, I'm going to read this anyway. If you're unsure about why you have been prescribed medication, you can always discuss these issues with your physician. So do open up to your doctors, healthcare providers, diabetic nurse, and believe me, sometimes and most times, the patient actually asks the nurse, reveals information to the nurse more than they reveal to the doctor. Maybe they have more time, the nurse have more time, and so on. But open up and share your concerns with the nurse or with somebody. But make sure you get the right source of information. So I think that's pretty much, Azani, SP, as to what I have to say and try and share and get across the important points about diabetes and its risk and how it breaks the heart of people. I hope I didn't scare you. I didn't scare you too much.
Thank you, Dr. Sri Azhari, for enlightening us on the relationship between diabetes and, unfortunately, how it accelerates heart disease and its progression. Now, we do have some questions coming in already, but what I'm going to do is I'm going to lead a discussion because it might be a bit difficult to answer each individual question. But we'll try and answer a theme around a group of questions as we go along. And then if there are more coming in, we'll try and fit that in as well. Now, one of the things that I noticed from the question coming in is people are concerned, right? If they have a family history, are they going to develop the disease? Now, Azhari, just now you mentioned the loaded gun in the drawer. So
yeah, I say that purposely for dramatization.
Yeah, so if we go back to the analogy, if you have a loaded gun in the drawer, don't bring it out.
Correct.
Yes. Don't be like the Americans, right? Don't be like the Americans. And one of the problems with Americans is if anything, they have even higher prevalence of obesity, probably diabetes than we have. So the question is, if I had a strong family history of diabetes, how do we prevent? Number one, from getting diabetes. So that I'll ask SP Chan to discuss a little bit. And secondly, if I do get diabetes, how do I prevent heart disease? And then we'll move to Azhari for that part. Okay, so over to you, SP.
Thank you very much, Dr. Azani. So I think we've set the scene in terms of the fact that diabetes is common. We've set the scene that you should take it seriously. We've set the scene that this loaded gun is out of the drawer already. I like that. So let's talk about people with a very strong family history. There are several questions that come there. All right. So the genetics does play a very important part to when somebody will have a chance to become diabetic. So if you don't have a healthy lifestyle, have a sedentary lifestyle, don't exercise, gain a lot of weight over time, then that genetic risk is exposed. So in a way, that loaded gun comes out and gives you a lot of problems, okay? How can you prevent it? Many of our patients are overweight and obese. So if they can reduce their weight, they can reduce their chances of becoming diabetic. It's not 100%. All right. I will still see a lot of patients who unfortunately eventually become diabetic, even though they lead the best healthy lifestyle. That's because the genetic influence is too strong. But if it is related to being overweight and obese and being inactive, if you change that lifestyle, you can prevent from becoming diabetic by up to 50%. So in fact, that's very good news. Lose weight if you're overweight, lead a healthy lifestyle, and you can prevent becoming diabetic by up to 50%. What you said earlier on about a lot of the patients that I showed that graph, not realizing that they are diabetic, and that's one of the main problems. Up to 1 in every 2 people with diabetes in that survey did not realize they were diabetic in the first place. And therein lies the danger. This loaded gun is out of the drawer, but they don't know it's there. So I think another perhaps point to take home is go and check. Don't sort of be an ostrich and hide your head in the sand. Don't want to know because mother, father, diabetic, brother, all diabetic already. I feel okay, so I must be all right. Wrong, right? Because diabetes, when the sugar goes up, is no symptoms. They feel nothing, they feel no pain. And so sometimes they would rather not know because they feel that they are fine. So please go and check, especially when you have a very strong family history. There was a question, 5 out of 6 brothers and sisters are already diabetic. That one staying supposedly normal, I don't think so. All right. One more point to make is even when they are pre-diabetic, not yet diabetic, but the sugars are in between normal and being diabetic, they are already developing heart disease. So therein again lies another message. If you are already what the doctor tells you, Mr. So-and-so, Madam So-and-so, you have sugar levels that are in between diabetic and normal, please, again, pay attention. because the chances of you already starting to develop heart disease is already high.
So that brings up several important points. And there was another question on whether diabetics have symptoms and what are the symptoms to watch. And SP, you touched on that very well. A lot of patients, especially in the early stages, don't have any symptoms. And just because you don't have symptoms, it doesn't mean you might not have a problem.
Not there. All right.
Yes. And that's why we have patients who are not aware and undiagnosed. And it's not just in diabetes. We see that in other diseases like high blood pressure. You know, in Malaysia, we only diagnose about 40% at best, because people who don't have symptoms in Malaysia tend not to go to get checked. Yeah. So if you have family history, the message is family history, and especially if you have other risk factors like obesity, sedentary lifestyle, please go and get checked. Yeah.
Absolutely.
As a follow-up to that, there was a question interestingly said, or rather asked, can diabetes be reversed?
Oh, that's a very good question. The answer is yes. And that's the good news, because there has been some recent research to show that if you're a big individual, overweight, obese, and develop diabetes because of the genetic risk, if you actually go on a very low calorie diet to allow you to lose weight up to about 10 kilograms or 10% of your body weight, you can reverse the diabetes. That means become non-diabetic, not needing medication. But remember, this is not the answer to everyone, because if that person is already thin, that person losing weight is not going to reverse their diabetes. So it depends on that person.
Okay, so it depends on your body shape, as it were.
Yeah.
Yeah. And we also had some evidence of this from patients who underwent bariatric surgery to lose weight. Yes. And they go under surgery, shrink the stomach or remove part of the intestines, and they lose weight and they reverse the diabetes. Correct?
Dr. Azani, the data from bariatric surgery is even more exciting.
Yes.
Because as soon as they have had the surgery, even before they lose weight, they're already reversing the diabetes. Something happens to the hormonal environment. So if there's a person who is grossly obese, who has difficulty trying to lose weight, bariatric surgery can reverse their diabetes as well, but not if they've had a long duration of diabetes.
Sure. Or if it's progressed too far. So, Azari, not to you. Patients who have diabetes, the risk factors for developing heart disease, diabetes is one of them. And there are some which are commonly shared. Lack of exercise, sedentary lifestyle, smoking, high blood pressure. We see 80% of patients with diabetes have high blood pressure. So give us some thoughts on how you can prevent getting heart disease if you already have diabetes.
Okay, the default is that if you have diabetes, sadly, the odds of someone having coronary artery disease are high. And it may be significant coronary artery disease or mild coronary artery disease. The spectrum is variable depending on various, how shall we say, risks factored in. But you have to assume the fact that there will be plaques in your body when you have diabetes. So for that very reason, we have shifted the goals. For example, your cholesterol level, if you are non-diabetic, is different from a diabetic, it's lower. The LDL level is lower. So if you have hypertension, the goal of a diabetic hypertensive is lower than the goal of treatment, is lower than somebody who has hypertension but no diabetes. So we make the assumption that you have to actively look for coronary artery disease present in a diabetic person. How do you do that? There's only one way, unfortunately. Number one is by screening, which is you check your blood levels and your blood pressure levels and the simple blood test. And number two is if you decide to assess further, depending on how your risk is and how your age, what your age is, and so on, go and see a doctor and he'll decide what best to do next. You know, they can start something simple, for example, with the stress test or whatever, or maybe more upscaling the investigation. But you have to assume that if you have diabetes, there is a high probability that you have coronary artery disease, and it may not be very severe, but it's there. Now, you must remember, when you have coronary artery disease, and as you are very familiar, Azani, is that majority of plaques, 2/3 of the plaque causing heart attacks, are the ones are not severe. So that means these are the plaques which do not impede flow. So patients go about their lives as normal, they can play squash, they can play badminton, but there is a plaque sitting there that unfortunately can rupture. So invariably, these individuals who have diabetes, or sometimes to pre-diabetes, they already have plaques and they have no limitation of activity, but they can rupture. So this is how you hear sometimes, oh, he's always jogging, he's always exercising, but then suddenly collapse from sudden cardiac death. This is because they have risk factors. They don't realize it. They may have diabetes. They didn't pick it up. They have high cholesterol. They didn't pick it up, and so on. And very often, high cholesterol, high blood pressure, diabetes actually coexist. So what is the most important message I have to say? In order to make sure that you are healthy or you stay healthy, is to do some basic assessment. The basic thing is blood pressure check and blood test. So that's the most fundamental step you can take.
Okay. So for people who have risk factors and a family history, first important point is go and get checked, go see your doctor, discuss with your doctor what you need to do, all right? And he will probably be able to tell you and advise you on which tests, etc. to do. So we won't go into the specifics here. Obviously, we don't have time. But another important point that Dato' Azhari made is that if you have diabetes, then we need to control everything else very tightly. Your blood pressure, your cholesterol levels, stop smoking, etc. Okay? Right. We're going to move on slightly, a different tack now. And we're going to move on. There are questions on treatment here. So before we actually talk about drugs, etc., let's talk about lifestyle. And particularly, there are lots of questions actually relating to diet. So for example, there was a question saying, is it sugar? Is it carbohydrate? Is it sugary drinks? Is it sugar in the fruits? What's the best diet for patients with diabetes?
Right. There is a lot of misunderstanding around diet and diabetes. The first misconception is that taking sweet foods, sweet drinks makes you diabetic. Wrong. False. Right? You don't become diabetic just because you're drinking sweet drinks. The sweet drinks or anything that you keep taking that has a lot of sugar, it's indirect. It's when you take a lot of calories in whatever form, whether it's in sugar or sweet drinks, and you gain weight. And then you have the genetic risk to become diabetic. That's when you become diabetic. It's not because you have been drinking all that sweet drinks. But unfortunately, once you are diabetic, you cannot handle the sugar. So even fruit sugar, let me just get that information out straight away. Fruit sugar is not necessarily healthy. A lot of my patients come and say, doctor, I'm not taking any sugar, but I'm having this big bowl of grapes. I said, that is too much. So fruit sugar, no matter in what form, whether it comes in a sour green apple or a sweet red apple, it's still, you need to limit the amount of fruit sugar that you can take if you are diabetic, right? So again, back to emphasizing, sugar in itself doesn't make somebody diabetic. You have to have that bad lifestyle, gain that weight, and take a lot of calories that will make you gain that weight and develop that diabetes, right? So then the next question is taking 2-in-1, 3-in-1, okay? And that's again a very common problem, teh tarik, kurang manis, which is a very common problem. You say, doctor, I don't take any sugar, but I asked my mama store to make kurang manis. That's an oxymoron. You can't have a kurang manis teh tarik because it's made with condensed milk, right? And so the 3-in-1, they say, I don't take any sugar, but 3-in-1 is so sweet, full of sugar. So again, this is something that the diabetic person needs to understand. They cannot handle the sugar, so they are better to take what we call less refined carbohydrate, more high fiber, so that it's sort of like high fiber wholemeal bread versus white bread, that kind of thing, right? You can't, as you say, go too much into depth with that, but certainly a lot of misunderstanding. The other question I think I'd like to say to answer is the question from some of these questions is, If I'm able to reduce my sugars down to a very acceptable number with 2 drugs, 3 drugs that are used for diabetes, can I stop it? Oh, please, please don't stop. You are well controlled because of that medicine, please, because we have not cured you. All right. The only time that you may consider yourself that you have reversed your diabetes is you have changed your diet and had your weight go down so remarkably that let the doctor decide whether you can come off or can cut down on your medication. Don't stop, because as we have already said time and again in this messaging, that high glucose is not symptomatic. It does not make you ill. You feel relatively well. And that's the reason why traditional health healers and traditional therapies are so popular, because they say, look, it's not a drug, ma. So, and I feel well, ma, means I'm fine, right? No, wrong, right? Okay, so I'd like to perhaps now take the next question, ask perhaps Dato Sri Azahari to talk about cholesterol. There's a question on cholesterol and all these cholesterol conspiracy theories. To you, Azahari.
Okay, cholesterol is a major contributor to coronary artery disease. The problem is cholesterol itself is not a lonely player. It works in tandem with other risk factors to damage the lining of your vessel. So you can have a normal cholesterol, but if your lining of the vessel becomes damaged from various reasons, and number one we're talking about here is diabetes, but it may also be smoking, it may also be hypertension. So once the lining gets damaged, this cholesterol, whatever little particles, whatever small numbers are, it can enter these cells and subsequently start the process of what we call atherosclerosis. So that starts to begin and progresses and so on and so forth. So cholesterol, there is overwhelming evidence about cholesterol role in coronary artery disease. There's no more a hypothesis, what we call cholesterol hypothesis. There are now various lines of the evidence. And I will tell you the lines of evidence. Number one is genetic line of evidence, which means nobody interfered. They were born with a gene which has low cholesterol levels in Italy. So this is called genetic polymorphism. I mean, it's just genetic thing. So these groups of individuals, they followed them through, but they have low cholesterol. They hardly have coronary artery disease in their population. This is in southern Italy. So until they are old, no, very, very little coronary artery disease. That is the genetic, natural selection of people with low cholesterol levels not having coronary artery disease. One group of evidence. There's another group of evidence in which there's intervention, which means that these people with coronary artery disease, we give them medicines to lower the cholesterol level, and we see how many of them actually develop coronary artery disease. So we find that the lower the levels are, the less likelihood the coronary artery disease progresses. So really, there is good evidence to suggest, and it's a linear relationship. That means for every unit of cholesterol comes down, there is a corresponding unit of reduction in coronary artery disease. So it's no longer a theory. But some people still go back to 30, 40, 50 years ago saying that this is a contentious issue. It's a bit like smoking, you know. There was once upon a time during Clark Gable's time and all the oldies who said that, you know, smoking is not dangerous and so on and so forth. Then the evidence came out and nobody still believed, everyone still believes that there's no evidence. It's like that. So cholesterol now has overwhelming evidence that it does contribute to coronary artery disease. So really, if you have heart disease, you must bring a target to a lower level than if you don't have heart disease. So the targets are different. We'll talk about it another time. But the targets of somebody who has had a heart attack, who has had a coronary artery disease, who has had stenting is different from somebody who has diabetes, who is different from somebody who has just a normal cholesterol level. So the levels are becoming lower and lower in terms of target. Yeah, we're not talking about the total cholesterol, we're talking about LDL. Just remember that number. LDL level cholesterol are the bad cholesterol as opposed to the good cholesterol. So LDL is bad cholesterol, and we always use that as a marker of risk reduction. So we target that level as far as possible in trying to reduce. Now, going back to the story of, I want to tell a story before we finish. I want to tell you a story about the late Prof. Kukalin, one of my friends. So he told me a story about, you know, diabetes reversible or not. I said, you know, I got a patient, doc, you know, he's obese, he's an overweight patient, he's got hypertension, he's got diabetes, he's got high cholesterol, and so on and so forth. Then I told him you have to take medicine. He said, I don't want to take medicine and all that. So then a few years later, he came back to see me, and he has lost weight. He's got no hypertension, no diabetes. no high cholesterol, nothing. He was okay. He was blood tests were all normal. So that's what Khalid told me. He says, I asked him, what happened to you? How did you manage all this? You know what he said? He said he went to prison. I'm not saying that. I'm not saying. I mean, this is a serious story. Yeah, this is what he told me, and there is good evidence that things can be reversed. The moral of the story is not that you want to go to prison, but the moral of the story is that you should actually do something, and you can do something to reverse the disease process. So cholesterol is one, as I mentioned to you earlier on, exposure to cholesterol and the duration, and then blood pressure, and then of course diabetes, which is cholesterol, sugar.
Azani, I want to give another story. Okay.
Oh, okay.
I say that the MCO has been very good for my patients with diabetes. My practice, as well as practices of some of my colleagues, endocrinologists, have seen that during the first MCO, when everybody was really locked down, couldn't go out, couldn't access mama store, the diabetes got better. They lost weight. It's like prison, So actually, it's true. The problem is Malaysia full of shops opening 24 hours a day now, maybe not so easy lah. But certainly, if you keep to a better diet, eat at home, don't eat so often out, you find that diabetes is easier to control. So our own form of prison with MCO, diabetes got better. Dr. Azani.
Okay. Interesting stories, but I think an extremely important message in both the stories. And the important message is the problem is with lifestyle.
Yes.
That's the problem, the key to all this. So if I think we have to emphasize, right? Even if you are on medication, even if you have to inject yourself with insulin or the other medicines that we now inject patients with diabetes with, you still have to control your lifestyle. Everybody, right?
Yes.
Whether you have diabetes, whether you are pre-diabetic, or if you are normal and you want to prevent diabetes, I think lifestyle is the key. Would you not all agree with that?
Absolutely, Azani, just a word. Lifestyle is still important, even whatever medication you're on, right? If you are on medication and yet you don't keep to a lifestyle, that medication cannot control your glucose or your diabetes, as we call it, right? And so one of the questions was, can I control my diabetes without needing medication? And the answer is depends. It depends on you. It depends on your circumstances. Not one size fits all. In some patients, no matter how much they control, and they can exercise till they are blue in their face, they cannot control their diabetes. They will require medication to do so, right? And the medication can range from tablets to injections. So please don't just do it yourself and say, I just listened to Dr. Azani and Dr. Chan and Dr. Dato Azari, and they told me can do it with lifestyle. Please, that's not what we say. Monitor your sugar, go and see your doctor, see where you are. And some individuals can do without, but many will require some form of medication to control the diabetes.
Even if you are on your medication, it doesn't mean you can forget the lifestyle part.
Exactly.
Exactly. Right. Okay, we have to wrap up. We're running out of time. Very interesting discussion. So I need to ask both our speakers one take-home message, the most important take-home message from each of you. Who's going first? SP, maybe you can go first.
Sure. Thank you for tuning in. We've had a nice time with you. We hope that you have learned something. Diabetes, the epidemic is here. We have a big burden of disease. It starts young. And the longer you have diabetes, the longer you have a chance to develop heart disease. Diabetes is a common contributor to broken hearts. But we can control the diabetes. We have medications to do so. And that control of diabetes plus specific medicines that can protect your heart specifically, all right? And that's the reason why we are having this conversation, to have that message go out. Ask your doctor about drugs that can protect your heart, can protect your kidneys, that is beyond improving glucose control. So there is hope. Don't give up.
Okay, me, I only have one word or three words: prevention, prevention, prevention. So you have to prevent disease and that includes diabetes, hypertension, coronary disease, obesity, and so on and so forth. So prevention. If you fail to prevent, you have to take medicines. There's no two ways about it, but choose the right medicine. In order to do that, you have to get information. In order to get information, you have to see the right people. In order to see the right people, you have to get the right advice. So you have to do things sequentially, I'm afraid, in this world. So anyway, thank you everyone for spending time with all three of us. And thanks to the organizers for organizing this.
Okay,
and thanks, Victor, of course.
My final message to everybody is, despite feeling well, not having any symptoms, if you have risk factors, if you have a family history, go and get checked. Because if you don't get checked, you don't know. If you don't know, you can't get the help that you require. Okay, I'll pass back to our organizers for any final words. Thank you very much.
Thank you, Dr. Azani, for moderating the session. It was indeed a fruitful session, and I believe that the audience have learned a lot from each panelist and have some very valuable takeaways, especially to those who are suffering from diabetes or are taking care of someone diagnosed with diabetes. Before we end the session, I'd like to do a quick evaluation poll to find out more about how you found the overall experience in this session. Your opinion actually really matters to us. On behalf of the Star Media Group, I'd like to thank Boehringer Ingelheim for coming on board with us, and also to our speakers, Datuk Sri Dr. Azari Rosman, Professor Dr. Chan Siu Ping, and our moderator, Dr. Azani Muhammad Daud. For those who like to rewatch tonight's session, you'll be able to do that on our Starbiz Facebook page. Thank you very much. Good night and take care. Stay safe.
Have a good weekend.